Good morning. This is Dr. Sunita Chandra from Lucknow, practicing infertility specialist for last 30 years. So today I am going to talk about smoking, its effect on women well-being. I'm not talking about males, I'm just talking about females today, because smoking, either in the form of cigarette, e-cigarette or hookah, has become very common. And I think you will not believe that around 40% of our youngsters are doing some kind of smoking in the form of cigarette, e-cigarettes or hookahs. And why it is very common? Because all these tobacco industries are targeting young generations. They'll say hookah is not harmful, e-cigarette is not harmful, but everything has nicotine. So please be aware of it, that nothing is harmless, whether it is cigarette, bidi, hookah or e-cigarette. Everything is harmful. I'll tell you what are the bad effects of smoking. So it contains nicotine and CO and tar. Everything is harmful for our blood circulation. So if I talk about infertility, or if I talk about your egg quality, or if I talk about your cycles, everything is being related directly with smoking. So these youngsters, when they smoke, they don't smoke 1 or 2 per day. I just asked one of my patients, she said, I'm just taking hookah. I said, how many? Then her husband said, doctor, 2 packs of that material in the hookah thrice a day. Then she showed me what does it contain, and I showed her, see, it is not even nicotine, it is in that it was marijuana also. So they had some kinds of drug substance also. Please, when you go for hookah or smoking, just see what are you doing, what is actually you are up to. So please be aware of it, because it actually makes you difficult to get pregnant. If you get pregnant, it gets bad effects to your baby. You can have missed abortions, you can have preterm labor, preeclampsia, some visual defects in your babies, some developmental delays in your babies, mental problems in your babies, because of prematurity, long admission in NICU, because of infertility, you are again and again going to your doctors. And during pregnancy, your baby is not actually the normal baby. Your baby is not developing normally as the other females who is not smoking. Why? Because they have growth retardation. Liquor is less, preterm deliveries are very, very common, and because of all this, babies have problems in their future life. At birth, you may just see the baby is lower, baby is having weight lower than his or her gestational age, but later they have all kinds of problems in right from developmental delays to visual disturbances, some ear problems, adjusting problems, then you have neuropsycho problems in the babies. So I feel instead of having these all problems in your baby, once you are planning that you are going to get pregnant, please stop smoking. It is not decreasing the quantity. Even your husband has to smoke somewhere, distant from the house, or maybe on the terrace, maybe on the roof, because even the passive smoking is bad for the baby. If you are smoking and you are breastfeeding, then please smoke before that, before feeding your child, not during lactation, and not in the same room. Because if you are smoking in the same room and you are then giving feed to your child, then your child is smoking passively. So please remember all these things. And my actually strong appeal to all youngsters, to the media persons, that please make a bold statement not to smoke. No decreasing smoking, but not to smoke. Please stop smoking. Thank you so much.